What are the advantages of using DTI over head CT or brain MRI?
Great question, because this is an area where we see a decent amount of confusion around, particularly in the personal injury space. CT scanning is the imaging modality of choice for the brain right after trauma. So accident victim is rushed to the ER in the ambulance. One of the first things that he's going to get is a brain CT scan to look for gross macroscopic injury. Epidural hematoma, subdural hematoma, intraventricular hemorrhage, subarachnoid hemorrhage, diffuse axonal injury, increased intracranial pressure, brain herniation. These are all terrible things, but these are often seen in severe trauma on a plain vanilla CT scan. Macroscopic, big abnormalities. Let's say that's negative or positive, but then a few weeks later, a few days later, the physician for the patient orders a brain MRI. That might give some more detail about those injuries. Again, macroscopic anatomical structures. These are distinct from DTI. While DTI is a subcategory of MRI, it's a special type of MRI, it's not the same as plain vanilla MRI. DTI specializes in seeing the white matter tracts of the brain, which are microscopic. There's trillions of these connections that we all have in our brains. And these connections make up who we are, our memory, our personality, our education, our sleep, our speech, our mood, etc. As you can imagine, if there's trillions of these connections and one undergoes trauma, oftentimes these connections are severed, they're cut. And the symptoms you see in your patient clients, which we talked about in another video, memory, mood abnormalities, sleep abnormalities, anxiety, depression, you name it, they're a direct result from these fibers being torn and severed and sheared. The connection's lost. Only DTI can see those microscopic connections through an indirect and somewhat technically intensive way. CT scanning and MRI cannot do that. So they're not the same. We've had this many times where we've seen a patient client, and they have real symptoms and they have a real history of trauma. And they've had a head CT and they've had a plain vanilla MRI, both were negative, or normal, or unremarkable. And the personal injury attorney working with them, sometimes even the physicians working with them, thought, well, that means that they don't have traumatic brain injury. That's not true. They may or may not, but CT scan and MRI cannot rule out microscopic traumatic brain injury. They are not, in epidemiologic terms, they are not sensitive for traumatic brain injury. DTI is. A DTI scan done correctly from a technical standpoint, there's a lot of parameters that have to be done right. If that DTI scan is done correctly, it can, with a high degree of confidence, rule out or rule in traumatic brain injury at the microscopic level. We TBI Imaging Associates specialize in DTI scanning. We have 32 imaging affiliates all across the country, usually within driving distance of most patient clients. Give us a call if we can serve you and your patient clients.